from the internet. And we also, my daughter's deaf, so we had a referral by some mental health experts, actually in Massachusetts. And we contacted the school for the deaf in different states, and so it was multiple sources, the internet and then professional referral. Well, there were a lot of things that happened. There was multiple hospitalizations where she had threatened to do harm to herself. And we're from Iowa, and the mental health treatment for teenagers is really not readily available. So she'd have an episode, and then there'd be a short hospitalization in an acute mental health center. And we just felt that she needed something long term. The actual precipitating event was a suicide attempt. It was a good experience. The admissions team explained everything. We were obviously concerned, had a lot of questions because we're from Iowa. But the admissions team was very, very sensitive to our needs, very professional, and they calmly answered our questions and explained everything. It was a good experience. My first thoughts were actually I was impressed with the doctors. There were two clinical psychologists that I felt very comfortable with. Madeline's mom and I wanted her to have a place where she could have access to physicians, psychiatrists, and then psychologists as well as counselors. And this, I was really relieved that she'd be safe and have access to, the various professionals she needs to help her in her situation. Well, I think it's very beneficial. Madeline, when we came in January 3 months ago, it was really an acute situation, and her mother and I didn't know if she was frankly going to survive. And I feel, as well as Susan, her mother, both feel that this is a life-saving therapy or life-saving event for Madeline. So we think it's very important. Yes, I think that was, yes, we did. And that's something that healthy boundaries and self-care is something that Dr. Tagg and Dr. Manis really stressed over time, yes. Well, first of all, she didn't want to kill herself. And so that's a good change and an improvement that I see in Madeline. She's better able to communicate. She's happier. She's able to deal with stress a little bit better. Her situation or her diagnosis was bipolar. And so I think the medication provided by the psychiatrist has helped her kind of level her mood a little bit. And then the counseling and psychotherapy by the psychologists have reinforced what the medicine has done. And the counselors have reinforced the whole thing. It's just been a collaborative effort to make her better, I guess. Yes, I thought the staff was professional and compassionate. Yeah, I thought all the staff that I've encountered. Yeah. I don't know where the treatment resident. I've not seen the treatment residents. I've just talked to Madeline about where she stays, and it's adequate. It's a supportive place that enables healing. I think you should do it. It's, like I said, it's a lifesaver for our family, and it just, like I told Dr. Manis and Dr. Tagg, it really prevented a lifetime of grief and mourning. And it's a leap of faith, it really is. And it's scary because we're from Iowa. To come to California and leave your child here but just it's sometimes, it's the right thing. It's the hard thing, but it was great for us.